People have MS in different ways. It manifests itself differently. So there's some general things that if you have MS and you have some limitations that you want to think about. One of them is that fatigue is an overriding symptom. So we want to work around your fatigue levels. Some people have pain, so you're going to want to work around your pain levels. Some people are very heat intolerant, and the heat can bring on exacerbations or a worsening of the symptoms. So your selection of activities should be sort of a function of how you are feeling. And so it's important to select activities that are well tolerated, like being in the water. Water exercise is great because you can activate and exercise all of the muscles. There's a very low risk of falling. And falling and balance are two other major issues when you have MS, especially if it's moderate to severe in nature. So exercising in the water is very safe. You can't overheat because there are temperature issues when you exercise. If you're very sensitive to overheating and you have symptoms and you get more fatigued, you become more dizzy or unsteady on your feet, then being in the water is a great issue. Another issue is using pieces of equipment that have built-in fans like a rowing ergometer or an Airdyne combined arm and leg bicycle, or having a fan in the room. It's also important to make sure that the temperature is controlled and that it's no higher than 72 to 74 degrees, and that you keep the humidity down as low as possible. Some people like to exercise with an air conditioner or a big portable fan. And some people have issues with bowel and bladder, and as a result of that, they tend to be cautious of how much fluid they take in. However, if you're sensitive to heat and you've had an issue before where you've overheated and felt maybe weak or dizzy or unsteady, you may want to discuss with your doctor or your healthcare provider a fluid intake plan for your exercise program. So that becomes really important. Another thing that's important is that you might want to start a new exercise program, a novel exercise program from a sitting position, especially if you're not sure if your legs are going to fatigue or if you don't typically stand when you do things, if you typically use a wheelchair. Seated exercises like an upper arm bike might be good, might be better tolerated than using a bicycle. Sometimes a bike might be okay, or a bike where you're sitting in a recumbent position, sort of leaning back, might be okay. Another really big thing that's important for you to know is that you don't have to do all of the exercise at one time. So if you're doing some endurance exercises for your heart and your lungs, like using a bike or using a recumbent bicycle or an arm cycle, or even if you're exercising in the water, you can do a few minutes of exercise and then recover for a few minutes. We call that intermittent or interval training. And with the newest physical activity guidelines for Americans, the second edition, they are now encouraging people who have not been getting a lot of activity and are not used to being active to not worry about, A, not worrying about trying to do it all at one time, but B, not even trying to do it in a minimum of 10-minute blocks, because not everybody can do that. So small amounts accumulated, maybe even throughout the day, might be the way to go. So my take-home message for you is that you do what you can comfortably without getting a flare-up or increasing your symptoms.